Hi there. Nice to meet you. My name is Rosa. I'm one of the nurses that work here at the Whisper Wing Clinic. Yeah, I'm just going to be getting a little bit of preliminary information and taking some of your vitals before the doctor gets in today, okay? Okay, so could you just start out by confirming your first and last name for me? Okay, excellent. And your date of birth? Good. Then what are your preferred pronouns? Okay, great. Just make a note of that here. All right. Now, it looks like this is your first time at our clinic here, right? Okay, well, welcome. I'm glad you chose to get your care from us. I know I'm a little bit biased, but I think you made a great choice. Is there any particular reason why you decided to start coming here? Is it you moved or a change of insurance or... Okay, yeah. Okay, great. Well, hopefully we can make your transition as smooth as possible, okay? Okay. Now, it looks like you did sign our consent to request your medical history from your previous clinic. Thank you. It's very helpful. Most of your medical information then we'll be able to get from that transfer once it goes through in a couple business days. But just for today, I do have just a few quick questions, okay? Just to make sure that we've got our bases covered. Okay. First of all, are you taking any prescribed medication right now? Okay. All right. And then have you taken anything over the counter, like aspirin, antacid, something like that, within the last 12 hours or so? Okay. Good. All right, and how about allergies? Any that you know of? Okay. No latex allergies? Okay, good. We do use latex gloves here. I mean, we have some nylon ones that we can use if there's a patient that needs it, but for the most part, we use the standard medical grade latex gloves. All right. And do you have any specific questions or concerns that you'd like to talk to the doctor about today? Okay. Well, if you think of anything, she might ask you to, but if you think of anything, you go ahead and stop her at any point, okay? Okay. All right, now, really quickly before the doctor gets in, I'm just going to go ahead and take a couple of your vitals, okay? So I'm going to start out with your blood pressure. Which arm would you like me to take your blood pressure on? This one over here? Okay, perfect. Why don't you just roll your sleeve up for me a little bit? I'll need a section right above your elbow. Okay, I'm going to go ahead and slip on some gloves really quick. Okay, if you could go ahead and uncross your legs for me. Make sure your feet are flat on the floor too. Just helps us to get the most accurate test. Alrighty. Now your blood pressure is a test that basically it measures how hard your heart is working. So if your blood pressure is too high, then that means that your heart is working too hard. But there's lots of different medications as well as different supplements and things that we can try to just give your heart a little help if it needs it. Okay. Just put this cuff on right here. Nice snug fit there. Is that okay? All right, good. Get these guys on. Okay, I'm going to inflate the ball here. You're going to feel some snug pressure on your arm for a moment. Okay, sounds good. 110/70. just about exactly where we want it. Get that cuff off for you there. There we go. Write that one down really quick. Okay. I'm going to take your temperature as well. This has been sterilized. It's fully cleaned and sterilized between each patient. So I'm just going to put this right under your tongue. If you could open your mouth for me. There you go. Close. All right, perfect. While we wait on that, I'm also going to take your pulse. Can I just grab your wrist there, please? Okay. Okay, great. Oh, sounds like that's ready too. Excellent. Well, you are off to a great start today. Temperature 98.4. A resting pulse of 70. Doesn't get much more perfect than that. All right, well, I will go and let Dr. Sage know that you're ready. But before I do, we actually have, over here right behind me, I have a diffuser. That's a humidifier and a diffuser, just to keep our air nice and clean and moisturized. And I also have a few different essential oil mixes that we could put in there as well. Is that something that you would be interested in while you're waiting? Okay, great. Now I have one mix that's good for sinus relief, one that helps boost the immunity, and then one that helps you relax. Which one of those would you like today? Okay, great. I will get that set up, and then I'll go get the doctor for you, okay? Okay, great. Okay. Hi there. Nice to meet you. My name is Dr. Sage. I'll be running your comprehensive physical examination today, all right? Now, could you just confirm your first and last name for me? Okay, and your date of birth? Okay, perfect, great. Now, a comprehensive physical exam, it takes a little bit of time, but it's relatively simple. It's a number of different tests that just make sure that everything's working properly. Is there any particular reason why you wanted to get a physical exam done today? Okay, sure. Awesome. Love to hear that. You know, preventative care and coming in for regular wellness checkups and that kind of stuff, it's a really great part of what we do here, just to make sure that everything's going well, and sometimes we can catch serious things before they become too serious and all that kind of stuff. So I'm glad you're here today. So a physical exam it's a bit extensive, but pretty simple, pretty straightforward. We'll be doing a number of different tests, ranging from just sort of a visual exam, just sort of letting me make sure that there aren't any, obvious anomalies or irregularities. And then we'll move into a cranial nerve portion, where we'll be testing several of your senses and your motor skills in your head and neck and shoulders. And then we'll do just sort of an overall exam of your heart and your lungs, as well as your musculoskeletal system. So all of these tests, like I said, are pretty basic. But if at any point during the test today you have any questions or you feel any sort of discomfort or pain, let me know right away and we'll stop, okay? Okay. Now, before we get going, are there any questions, any specific health concerns that you'd like to talk about today? Okay, well, if you think of something, or if, something comes up or anything at any point in the test, you go ahead and stop me, okay? There's never a wrong time for questions. Okay, sounds good. Let me just pop on a pair of gloves. We'll get started, okay? All right. All right, so like I said, we're going to start with just sort of a visual examination. I'm just gonna kind of move around your face and your head and your neck and make sure that I don't see anything right off the bat, okay? Now, throughout this test, I am going to have to touch you, mostly just on your head, your neck, your shoulders, your wrists and hands. Is that all right with you? Okay, thank you. So let's just start out. Make sure that I don't see anything. Right now, mostly what I'm looking for is any sort of irregularities on the skin, any sort of rashes or redness or spots of irritation, as well as anything that looks like a lump or a bump that shouldn't be there. Any sort of contusions. Don't see anything. Okay. Looking good. You said you didn't have any specific things that you wanted to talk about today. All right. Good. Okay, so now I'm going to just take a comb and brush through your hair a little bit and take a look at your scalp, okay? Just make sure that there aren't any sort of spots of irritation, dry scalp, things like that. Have you noticed any dandruff or anything like that lately? Okay, good. Good. Yeah, I'm not seeing anything. It's looking good. No areas of redness or excessive flaking. Good. Okay, great. Now for this next part, I'm going to be just sort of feeling around your cranial structure, making sure that I don't feel any lumps or bumps or any fractures in the cranial bones. I'll also be checking for cheekbones, brow bones, things like that, just making sure that everything is as it is. Okay, now if at any point during this me pressing gently on anything causes any sort of discomfort or pain, you let me know right away, okay? Okay. Let's just make sure here. Everything feels pretty good. I'll move my hands around to the back here. Right, not feeling any sort of lumps or bumps or anything of concern there. Good. All right, check by your temples here. If I press there, does that hurt at all? Okay, good. Good. All right, moving down to some of your facial bones. Press on your brow bones there, a bit on your forehead. No discomfort there? Okay, good. Moving down to your cheekbones. Just going to lightly press. Is that all right? Okay, good. Move to the side of your face here. Feel your jaw a bit. Is that all right? Good. Your chin. Okay. Just lightly press on your nose up here too. Make sure that cartilage is okay. All right. Good, good. All right, now I'm going to move back and just sort of feel your lymph nodes and that sort of area down here. Make sure there isn't any sort of bulging or anything that shouldn't be there. Okay. Nothing painful there? Okay, great. Move down and just press gently on your collarbone, if that's all right. Okay. Everything feels nice and solid. No pain there? Okay. Good. Good, good, good. All right. Great. Looks like nothing wrong with anything there. No discomfort for any of that pressing. Okay, good. All right, I'm going to take my light here, my tongue depressor. I'm going to just take a look into your throat really quickly, okay? Look at your tonsils and the inside of your cheeks and all that, okay? So I'm just going to put this just a little bit into your tongue. If you could open your mouth, please. Okay, perfect. Okay. I'm not seeing anything there. Looks good. No swollen tonsils or anything that looks irritated there. Do you go to the dentist regularly? Good. When was the last time you were there, would you say? Okay, good. Excellent. Yeah, that all looks great. No cause for concern there. Excellent. Now I'm going to go ahead and just take a peek around the sides and look into your ears a little bit too, okay? Just make sure that there's nothing concern over here. Let's start over here. Okay. All right, any sort of discomfort when I'm pressing on the ear like that? Okay, good. All right, that one looks great. We'll be actually testing your hearing and things like that later with the cranial nerve portion of the exam, but for now, just looking for any sort of irregularities or something, okay? All right, let's move over to this side. Anything there causing any pain or discomfort? No? Okay. Excellent. All right. That all looks great too. Good. So that's just sort of the preliminary portion of the exam. Making sure that there aren't any sort of obvious causes for concern. Looks like you are all set there. All right. Now we're going to move on to testing some of your cranial nerves. Now that's a term that we throw around pretty regularly, but it's not always explained what your cranial nerves are. So your cranial nerves are pairs of nerves that connect different parts of your head and your neck and your trunk, so the top part of your torso, to the brain. Normally we categorize them by either sensory nerves, dealing with your senses obviously, hearing, sight, touch, and motor nerves, which is things like moving your eyes side to side, as well as production in different glands, like your salivary glands or your tear ducts or things like that. All of those kinds of things are thanks to your cranial nerves. So they're rather important. And they're relatively easy to test as well, just to make sure that everything is working out okay. So let's start out with testing your optic nerves. Now those have to do with your sight, specifically how your brain receives information through your retinas. So your retinas, they have these different receptors in them that are broken into rods and cones. Now the rods help process things like value, light and dark, black and white, things like that. And then the cones help to process different colors. And then those little processors send information back to your brain, which is how we see. So we're going to test a few different things with that, make sure that you're seeing everything properly, okay? All right, so first up, I'd like you to look right over here behind me. We have our eye chart on the wall. Can you see that all right? Okay, great. Why don't you read that first big letter for me? All right, excellent. How about this third line down here? Can you read that letter? Okay. Yeah, go ahead across. All right, great. Now this next line, the fourth line here. Okay, keep going. Good, good. How about this sixth line? Can you read across there for me? Okay. Good, 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 good. All right, now how about this very bottom line? Just do your best. Read across there for me. Okay. Good. Mm-hmm. 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 Yep. Mm-hmm. All right. Great. Nice job. Now we're also going to test some color today too. You know, the rods are the ones that take care of things like being able to see clearly, being able to see black and white. And your cones take care of the color. So we're going to do something called an Ishihara color blindness test. So I'm going to show you different little circles, and they're made up of tiny little circles of different colors. There's two different colors, and some of those colors make up the shape of a number. All right, and then I want you to just tell me if you can see the number inside the circle. Pretty simple. Okay, here. All right, so what number do you see in this circle? Right. 16. Good job. How about this one? 8. Well done. How about this circle? 7. All right, and this one? That's right. 13. There we go. How about this one? 12. Perfect. Right, and this circle. That's right. 6. How about this one? Good. 15. And last one. How about this one? Good. Excellent. Looks like those rods and cones are both doing their job. Alrighty. Alright, now one last test for the optic nerves. I want you to keep looking right at my nose here, but we're going to test your peripheral vision, okay? So, you focus on my nose, but you tell me when my fingers are wiggling, okay? And which side they are. Okay. Good. Good. All right. Good. Nice job. Good job. Okay, now same test, but I'm going to hold them in different places around your peripheral vision. And I want you to tell me how many fingers I'm holding up when I do, okay? Okay. Okay. Good. 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 Okay. Good. Good. Excellent. Nice job. Looks like that peripheral vision is doing just fine too. All right, so now we're going to move on to your oculomotor nerves. So those are still related to your eyes, but these are more about how your eyes move as well as how your pupils interact with light. Okay? All right. So we're going to start out just looking at your pupil response, okay? So you can just look right at me. I'm going to be shining a light in and out of your vision, okay? You don't have to do anything. I'm just checking out your pupils. Good. Good. Okay. Good. 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 All right, excellent. Now this next one, similar, but this is going to test your consensual light reflex. And what that means is that usually when our pupils see light, they get smaller. When there's less light, they get bigger. But even if one pupil is the only one seeing the light, both pupils should still respond in the same way. That's why it's called consensual, because what happens to one should happen to the other as well, okay? So I'm going to take my same light, shine it in your pupils, but I'm going to hold my hand right in front of your face like that, so it only is seeing one pupil at a time. I'm going to watch the opposite pupil. Does that make sense? Okay, great. So again, all you have to do is look straight ahead, okay? Okay, here we go. Okay. Good. 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 All right, excellent. Other side here. Good. 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 All right, excellent. Nice job. All right, now for this next test, I want to see how your eyes move. Okay, so for this one, I want you to still just keep your head nice and straight. Don't turn your head at all. But I want you to follow the light. Okay, just with your eyes. All right. Okay. Good. Nice job. Excellent. You're a pro at that one. Okay. All right. Excellent. Now, this last eye test is relatively simple. Just want you to focus on the tip of my light here. I'm going to be moving it closer or further away from you. Basically, I'm just watching your eyes to see how quickly they focus on objects that are close up and objects that are far away. Okay? All right. Here we go. Good. Good. Well done. Excellent. Nice job. All right. Now we're going to move on to testing some of your facial nerves. These are the nerves that are responsible for all of your facial expressions, basically. And some of your also glands, salivary glands, tear ducts, things like that. But for our testing, we're just going to go through a few different facial expressions, okay? I know it might seem kind of silly, but it is important to know that all of your different facial nerves are working as they should, okay? Okay, so why don't you start? Raise your eyebrows for me. Good. Put them down. Up. Down. Okay, good. Can you smile for me? Okay, with your teeth. Good. Can you frown? All right, good. Now open your mouth really wide. All right, close it. Open. Close. All right, now can you wink for me? Good. Other side. Good. Nice job. Okay. All right, now, just to make sure that your facial nerves are working properly, sensory-wise as well, I'm going to be taking this right here. It's just a Q-tip that has a soft end on one side, just the stick end on the other side. I'm going to be pressing it into your face at different places when you have your eyes closed. And I want you to tell me if you feel soft or sharp. Okay? Not that it's really sharp, but it's pokey. Okay? All right, so close those eyes for me. Okay. Good. 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 Nice job. Okay. All right, now time to test your vestibulocochlear nerves, which is just a way of saying your hearing. So for this, I have a tuning fork here. So I'm going to hit it with this mallet. I'm going to hold it up to one of your ears. I want you to just tell me when you stop hearing the note, okay? All right, relatively simple. Okay, nice job. Go, other side. Excellent, well done. Now I want you to close your eyes, please. I'm going to be hitting this and holding it up to one side or the other. I want you to tell me which ear you hear it in, okay? Okay. Eyes closed. No peeking. All right. Okay. Okay. Good. Good. All right. One more time. Keep those eyes closed. Good. 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 Nice job. All right, and then the last set of nerves that we'll be testing for a physical exam are your accessory nerves. Now those are ones that have to do with moving your neck. Okay, so I want you to just keep the rest of your body nice and still. Turn your head to this side for me. Okay, turn it to that side. All right, back to the center. All right, now look up for me. Okay, move your neck down. Good. All right, now can you shrug your shoulders for me? Good. Can you roll your shoulders? Roll it to the back. Good. All right, now roll forward. Excellent job. All right. Those accessory nerves looking good. All right. Wow, I think that for a physical exam finishes up your cranial nerve testing. Looks like everything's working just fine. So let's move on to your heart and lungs, shall we? Take a good long listen to both of those. Make sure that everything's working okay, all right? Okay, I'm going to start out listening to your lungs. Just want to make sure that there aren't any irregularities there, no fluid or anything that shouldn't be there. So I'm going to start out just putting this right here on your chest. Take a deep breath in for me. Hold. Let it out. Good. Do a bit lower there. All right, same thing. Deep breath in. Hold. Out. Good. All right, other side. Now this lung. Deep breath in. Hold. Out. Nice job. All right, down a little lower here. All right, deep breath in. Hold. Out. Excellent. I'm going to come around the back here. Do the same thing. All right, deep breath in for me. Hold. Out. little lower down here. Okay, deep breath in for me. Hold. Out. All right, good. Come around to the side over here on your back. All right, deep breath in for me. Hold. And out. Good. And last time down here. Deep breath in. Hold. And out. Good. I'm going to just listen to your heart while I'm back here too. So go ahead and just breathe normally now. Okay. Good. All right. I'm going to listen to your heart in the front here. Just keep breathing normally now. Okay. All right. Excellent. All of that sounds perfect. Nice, healthy heart and lungs. Good, good. All right, now this final portion of our examination is just going to be doing a few different tests on your musculoskeletal system. So that's the system that, is responsible for most of your larger motor movement, okay? So we've already sort of tested your shoulders, but I want you to shrug your shoulders up, but I'm going to be pressing my hands down with some pressure, okay? And I want you to try to resist me. Still raise your shoulders, all right? Okay. Push up. Good job. All right, now I want you to hold out your arm. Either one is fine. This one first, okay? I'm going to press down on your arm, and again, I want you to resist me, okay? Try to keep your arm up. All right. Good job. All right, now this arm, same thing. All right, good. Now, if you hold your hands up for me, make a fist for me. Okay, open up. Fist. Open up. Good. Now, can you roll your hands? Roll your wrists there. Okay, good, good. Now, we're also going to be testing your reflexes a little bit, okay? So I'm just going to take this rubber mallet, hit it on your knees, okay? Just to make sure that we have that good reflex. Don't worry, it won't hurt. It's just, won't be any harder than that, all right? Okay, so you just sit there comfortably. All right, you ready? Okay. Good. Good. Other side. Good. Good. All right, now can you lift up your feet a little bit just to make sure those ankles are working? Okay, good. You can flex your feet down. All right, excellent. Well, I think that will do it for today. Now, did any other questions come up that you were thinking about throughout the course of the exam? Okay, sounds good. Well, like I said, there's never a bad time for a question. So even if you get all the way home today and then you think of something, you say, oh, I should have talked about that. You go ahead and you call my office, okay? We'll get it figured out. Okay, good. Well, if you don't have any other questions for me, I don't have any other tests for you. It looks like you are in perfect health. So, thank you so much for coming in today. Now, if you have any other health concerns in the future, absolutely let me know, big or small, whatever it is. We want to make sure we take care of you, okay? All right. If nothing else comes up, then I guess I'll see you next year for your next wellness check, okay? All right. Well, your appointment is completely covered by insurance today, so once you're ready, you are all set to go, okay? Thanks again for coming in. Have a lovely day.